The primary group of State Bar members that are going to be immediately affected are the members who were participating in the State Bar of Wisconsin Association Group Health Insurance Plan. Under the provisions of the law, those types of policies are no longer allowed to be in force, and so those members are going to be offered the opportunity to transition their plans to individual health insurance programs, but we would encourage them to take this opportunity to look at other options that might be available to them. My name is Corrine Bultman. I work at Bultman Financial Services in Brookfield, Wisconsin. I am the president and CEO of Bultman Financial. We've had a relationship with the State Bar of Wisconsin for 17 years, and we administer a number of member benefit programs for State Bar members. For individual health insurance, open enrollment is from November 15th to February 15th. If you want a January 1st effective date, you'll need to obtain the insurance by December 15th, 2014. There are a number of opportunities for members to, or a number of reasons members might explore the new health insurance opportunities. They might be looking for insurance for themselves because their employer-sponsored health insurance has changed. The association group health insurance plan they're participating in is no longer available. They also might have employer-sponsored health insurance available to them, but their employer isn't going to be paying any of the premium for their spouse or children. So those spouse and children are eligible for health insurance either on the marketplace or through an individual plan. The employee would not be eligible for a subsidy through the marketplace if they have employer-sponsored health insurance, but their children and their spouse may be. So, and then also employees, if there isn't an employer-sponsored health insurance plan, or the employees partaking in the employer-sponsored health insurance plan cannot afford the health insurance for their spouse and children, they too will take advantage of the open enrollment period. And it is complicated and worth having a discussion with someone about it, because I said 50 different types of people, so you can see that it depends on your circumstance. In 2014, some people enrolled in plans that they didn't understand. Carriers have changed policies to reduce costs, they've narrowed networks, they've they've gone from HMOs to PPOs. If people enroll in something that they didn't understand or that they don't like, the open enrollment offers people an opportunity to change policies that's more appropriate for their circumstance, or to get something that is more appropriate for where they'd like to receive care. And even also if you enroll in a plan that you didn't understand the provisions of the plan, for example, you've enrolled in a plan where there are no carriers in your area, there are things you can do outside of open enrollment, but I certainly don't recommend people rely on that. The law is very strict about when you can make changes to your policy. If you missed the open enrollment period during 2015, the only reasons that you could enroll in an individual policy are if you have a qualifying event, and that's whether you're obtaining your health insurance through the marketplace or with an individual carrier. So a qualifying event is defined as divorce or marriage, birth of a child, losing your employer-sponsored health insurance, moving outside of the geographic area. So there are a number of things that are qualifying events, but if you don't have one of those qualifying events, you cannot change your health insurance outside of open enrollment. Consider what type of deductible they want, the level of co-insurance they want. Do they want a plan that has co-pays rather than meeting 100% of the deductible before the co-insurance kicks in? Basically, what's their risk threshold for out-of-pocket expenses? And also then the networks that they want to receive care. So people can enroll in HMOs, which are health management organization plans. Those tend to be less expensive, but you need referrals for specialists. So how people receive care is a consideration in what type of plan they choose. And a lot of times I recommend that if people have concerns about a HMO plan, they might transition to a PPO plan in the beginning just to have sort of an easier transition. It depends what your family circumstance is. If you're a high utilizer, if you only see the doctor once a year for your annual exam, a high deductible plan might be totally appropriate. Bultman Financial has partnered with an organization called Go Health, www.gohealth.com/SBW. And that's a place where non-resident members can go to shop for insurance in their area. Health insurance is very regionalized, and so we are experts on the state of Wisconsin, but we don't hold ourselves as experts outside of the state of Wisconsin. And we want members to have a trusted resource, because there's been some misinformation about private insurance exchanges, but those are really just shopping portals for policies. All policies are the same now. It's governed by the law. And so private exchanges might choose certain carriers for their private exchange based on special interests or what have you. And so we want people to understand that this is an online shopping portal, as are all private exchanges, and they give the members very broad choices based on their regional area, the type of policy they need. Under the Affordable Care Act, online shopping portal called www.healthcare.gov was created. That's called the Marketplace, and that's where people who are subsidy eligible can shop for their health insurance. You have to obtain your health insurance through healthcare.gov to qualify for a subsidy. And a subsidy, it's an immediate credit that's applied to your premium, reducing the cost of your premium. And it can be very meaningful. So even families, for example, it's a complicated algorithm to calculate if people qualify for a credit or not, but a household with less than, a household of 4 people with a household income of less than $95,000 would qualify for a subsidy, which means that it would immediately reduce the cost of their health insurance premium. And also, depending on their household income, they might qualify for additional help in paying their out-of-pocket costs. So looking at the Marketplace and seeing if you're eligible for a subsidy, it can have a meaningful impact on your out-of-pocket costs for health care in your household. It is a very personalized experience, and so I really encourage people to have a conversation with us and give us some information about their actual circumstance, because people make assumptions, and it's very complicated. It's not so complicated that it can't be learned, but it's so new that people really don't have all of the information they need. So I've uncovered so many instances for lawyers where they've qualified for a subsidy and not known it, where they could have saved money by replacing their other insurance plan. It's really worth a conversation.